Hey, welcome to Sketchy EBM. I'm your host, Anthony Crocco, and today we're actually talking about what is evidence-based medicine. It may have occurred to you at some time or another to ask the question, what do people mean when they say EBM or evidence-based medicine? We hear this term thrown around all the time, and there's a number of different ways to think about the definition. One of the first things that people think about when they think of evidence-based medicine is it must mean the research, the actual evidence that's out there. What you'll soon see is that this is very limited in its definition and does not encompass all the aspects of evidence-based medicine. A second thing that comes to mind for some folks is the EBM pyramid. You may have seen an iteration or two of this, and usually at the bottom there are things like case reports or expert opinion, and at the top are things like systematic reviews, meta-analyses, or N of 1 studies. Sadly, the pyramid in of itself is only a rank ordering of the different types of evidence, and unfortunately is very limited. So let's then talk about the different components of evidence-based medicine. Most folks would agree that there's three important aspects to considering decision making when it comes to healthcare. The first thing is the evidence itself. We're not going to get away from actually getting our hands dirty and looking at actual papers and research and numbers and data. We have to know what's going on in the research. A second consideration are the patients themselves. Each patient comes to the table with a different set of values and preferences. What works for one patient may not work for another, and we have to think about that when we're looking at the evidence and trying to incorporate it. The third and final component is us, the clinicians. Who I am, where I work, and the experiences that I've had may be very different than yours, and how I apply the evidence to a specific group of patients, therefore, will be very different. Where we see these three things intersecting, the evidence, the patient values and preferences, and our own physician judgment and experience, is generally what we like to call evidence-based medicine. So I hope that helps you understand what evidence-based medicine is. Before we go, however, I think it's worth answering the question, are there any risks associated with evidence-based medicine? I would argue that there are in fact at least three. Firstly is what I would call evidence-based paralysis. You may have had this experience before where you have a clinical question, you go to the evidence to look for the perfect evidence, and lo and behold, it doesn't exist. After this, much dismayed, you're left with no answer at all, and therefore paralyzed in your decision making. One of the things with evidence is that there is no perfect evidence. If you find some, let me know and send me a tweet or a message on Facebook because gosh, I'd really like to see it. What we have to deal with is what's the best available evidence at any given time. And sometimes the best available evidence may just be expert opinion. A second major risk with evidence-based medicine is being taken in by the latest and greatest research and changing your whole paradigm of treatment based on one new study. I think it's really important to take a look at all studies that are done on a topic, and for this reason I really like looking at systematic reviews because they do just that. As a good friend of mine says, always be skeptical of anything you read. A third and final risk of evidence-based medicine is becoming what I would call an EBM a-hole. We have to be careful when we know of great research not to alienate the very people we're trying to teach with our way of presenting that research. Who you are, where you work, and who you treat may be very different than the folks that you're chatting with, and as such, the evidence may mean something different to them. Well, I hope that clarifies for you what EBM is all about. Thanks a lot for joining me on this episode of Sketchy EBM. Please do take the time to evaluate this episode, and until next time, always remember to draw your own conclusions.